Ruth had always wanted a 21st birthday party, and at age 95, she finally got her wish. Bonnie had always dreamed of going to Paris, and so, aged 104, Paris was brought to Bonnie. Betty got to experience a super fast hot lap of the Phillip Island Grand Prix track. Passionate swimmer Anne returned to the pool for swimming lessons after many decades. And David, who'd loved horses ever since he was a little boy, visited a thoroughbred racing farm. Despite being almost non-verbal and non-responsive, he smiled for the first time in a long time.
When he put his hand out, I think, and took in what was really happening, affected me the most. It was good to see that he was really interested and was with us.
This is all part of the Bucket List, an initiative by the Bass Coast Health Residential Aged Care Facility to give their residents the chance to do something they'd always dreamed of.
You know, these people are at the end of their lives and there are still things that they want to achieve. When you're giving them an opportunity to do something like this Bucket List initiative, it helps them regain that sense of purpose and identity. And it's a way of them to share who they are with the people around them as well.
The Bucket List is one of many outstanding contributions to this year's Victorian Public Healthcare Awards. The awards began almost 2 decades ago and throughout that time have celebrated the incredible achievements of our healthcare workers, public health services and volunteers. This year is no exception. You've developed projects that improve the health literacy, health access and health outcomes for our CALD communities. These health education sessions are all part of the Waterwell project, which was started by a first-year medical student who wanted to help migrant, refugee and asylum seeker communities to better understand our healthcare system.
Working as an intern in an emergency department, I was seeing, the effect of that lack of knowledge in the community translating to people ending up in hospital when they didn't need to be there. You know, that combination of my parents from refugee backgrounds, seeing those people similar to my parents in the emergency department and then going to hospital.
Linny started the project 13 years ago and it's now delivered more than 1,400 sessions to more than 19,000 participants in 40 different languages. Health professionals cover a whole range of topics, including nutrition, mental health, asthma and diabetes, with interpreters at every session.
A lot of the communities that we speak to, often in their home countries, would not have engaged in any sort of preventative care, whether it's cancer screening or vaccination. And so when they come to a country like Australia where we have such a big emphasis on preventative healthcare, I think it can get lost and that message can get quite confusing. So for us, it's really about making sure that everyone understands what is available to them and making sure that they take those steps to prevent getting sick in the first place.
As well as our CALD community, you've developed initiatives to help our First Nations people feel more culturally safe. The Koori Maternity Service at Northern Health has created a dedicated birthing suite complete with a mural of a traditional Aboriginal birthing tree. There's an acknowledgement of country and images of Aboriginal babies on the wall, and more recently, they've introduced possum skin baby wraps.
Traditionally, the possum skins, they told a story. And when babies were born, they were wrapped in a possum skin, which were burnt and painted, which told that baby's story. And as that baby grew to a child, more possum skins would be attached. And then as they became an adult, they would end up with a full cloak. And then quite often, when they passed, they would be buried in that cloak. So it's very significant.
A decade ago, about 3 Aboriginal babies were born here each year. That number has now reached almost 150.
We have Koori cuddling program as well. So any Aboriginal babies in the neonatal unit, we've got some wonderful elders who come in and cuddle the babies when mum and dad can't be around. And that's been really, really popular as well.
New services have been created for members of our LGBTIQA+ community, including the country's first publicly funded gynecological clinic for transgender patients.
Knowing that there are staff here who are aware and sensitive of their needs is incredibly important to them. That they don't have to explain themselves, that they know that we're going to treat them with respect.
Just seeing the look of relief on their face, that they don't have to justify being trans or explain what their medications mean or explain in detail about why their journey has been how it is. Our hospitals and health services are working hard to become more environmentally sustainable. South West Healthcare have replaced a whole range of single-use clinical plastic items, including kidney trays, injection trays, anaesthetic packs, pill and denture cups, with 100% compostable alternatives made from sugarcane. And because they're the central supply department for their whole region, they've had a huge impact.
All in all, we've diverted 1.5 million pieces of plastic from Warrnambool alone, but collectively as a group, nearly 4 million in 1 year.
I think it's such an exciting time to be in healthcare because there's a real growing momentum and awareness of the environmental impact of delivering healthcare, and agencies across Australia are innovating in all kinds of ways.
In recent years, our emergency departments have been inundated, and you've developed ways to reduce that pressure. The Victorian Virtual Emergency Department, VVED, was established during the COVID pandemic, and this year, VVED Kids was launched. It now sees around 150 kids a day, with 90% of them being kept out of physical EDs.
From a parental perspective, I think it's amazing to be able to reach out to high-level paediatric care and prevent that unnecessary attendance in the first place. We know it's really stressful for families to have to get into the car and drive to the hospital when they're worried about their children.
And then they're exposed to other viruses in the waiting room, there's a lot of anxiety, and when they're finally seen, their problem can be sorted quite easily.
We can actually provide a full medical consult. We can prescribe medications, direct you to your local pharmacy, direct you to radiology or pathology if you need blood or x-ray. So we can actually comprehensively manage the whole case.
As well as designing incredible services for consumers, you've consulted and worked directly with them. DPV Health has spent the last year working with almost 3,500 local community members to create a new mental health service. And it was the voice of one lived experience participant that led to it looking just like a restaurant menu.
We were sitting in a restaurant and people were ordering their food as we were chatting, and that's kind of where it began to really come into being, which was people just saying, I want a mental health service that I get to come in and I get firstly heard, but secondly I just get options.
Someone said, I just really would like to be able to, I don't know, like a menu. Like if we were here, where I could actually go, I want that, that, that and that.
I get to have a look at, what suits me, what works for me, just as we were ordering food. And I guess that was the genesis of that idea.
Our rural hospitals have introduced programs allowing people to receive vital treatment in their hometowns, including a tele-stroke unit at Echuca Regional Health. Maryborough and Castlemaine hospitals have established midwife group practice models of care, allowing more women to receive pregnancy care and give birth locally.
Having a local service that is a low-risk model available in the community means the world to all of our families coming through our service.
I think the option to be close to home is always really important.
Our metro hospitals have added new skill sets to boost existing teams. Alfred Health is the first in Australia to include a pharmacist on the medical emergency team to assist with administration of antimicrobials in patients with septicemia.
The sooner you give someone an antibiotic after being identified as having sepsis, the greater their chance of survival. The pharmacists are able to help with getting the antibiotics into patients faster because they know how quickly you can give certain antibiotics. They can help obtain the antibiotics and help draw them up and help the nurses with administration.
And parents have joined the clinical team at the Royal Children's Hospital. The One Team project aims to improve the early recognition of the deteriorating child.
They know when they're deteriorating, and that's what we as clinicians have to actually really understand, their expertise that they bring to the table, that they must be considered part of the clinical team.
You've successfully attempted new ways of communicating complex information to patients, including a podcast called The Straight and Marrow for patients undergoing allogeneic stem cell transplantation. Since it began, it's had more than 10,000 downloads worldwide. Last but certainly not least, there are our volunteers, who devote thousands of hours benefiting countless individuals purely for the love of it. This is Kerry, whose mum Olive was at the first meeting to establish the Busy Fingers Auxiliary half a century ago. She now runs it with Norma, who's been the treasurer for more than 20 years.
I think if you've had a good life yourself, it's nice to give back to those which are not quite as well as I am and lucky. I think that's a good way to go.
One stitch at a time, Busy Fingers has raised more than $3 million for Northern Health Bandura.
Every little thing counts, and if it makes someone's life that little bit easier for them, that little bit better for them, I guess that's, where we get our satisfaction.
These are just a few of the wonderful stories to come out of this year's Victorian Public Healthcare Awards. We'd like to say congratulations to all our 2023 finalists. Thank you for your tireless efforts and dedication towards helping Victorians become the healthiest people in the world.